earlier you referred to the legacy of heart surgery here in Washington, D.C. at Children's National. And I know you had an opportunity to meet Dr. Richard Jonas, our emeritus chief of cardiac surgery. Tell us what your impressions were and the influence in the field that you've conveyed to me and others.
When I first saw Dr. Jonas in doing one of my first 2 visits here, I told him I would not have looked at the job if it wasn't for him. He was a legend. I've talked about these pioneers who created the field. He's one of the pioneers. He's one of the few who determined what to do and not to do in pediatric heart surgery. His teaching was enormous in all fields of pediatric heart surgery. And I knew of the existence of the centers from the time he started here. The other thing is that the most important research work I think he's done is on brain and heart surgery. He's the one who unveiled the fact that we had such an impact on brain by doing what we thought were conventional surgeries. And the beauty is that he's continued this work and is still now pursuing that research in collaboration with me in the Children's National. So there's a trial that is ongoing where we're investigating better ways to preserve the brain during the surgery that we do.
Speaking of collaborations, I think it's a great collaboration between the cardiac surgical unit and the cardiac research that's going on here, much of which is focused on the brain of children, the developing brain, in particular, the research that Dr. Jonas does. And I think the opportunity to build a strong clinical program with great clinical outcomes and collaborate with this kind of research that's laboratory-based as well as clinically based is really important to the future of children with congenital heart disease. And we're really looking forward to that collaboration. Tell us a little bit about the structure of the Children's National Heart Institute that attracted you here in Washington, D.C., in terms of its organization, the components of the Institute, and the way you feel that structure enables you to accomplish your work more effectively.
It's striking. So immediately at the first contact with the hospital, I like the way that I could report directly to people who would make decisions. So you and first instance, and directly after that, Kurt Newman, the CEO. That was amazing to me, and I lived through it. So I've seen how dynamic is this structure. It's amazing. Coming from, public health system, which have their advantages, no doubt, but to drive changes, that's the best scenario. So we have a heart institute with co-directors, cardiac surgeon, cardiologist, intensive care, cardiac anesthesia, cardiac nursing. We can take decision together, have a very short administration structure, and a very quick turnover in terms of decision making. For improvement and innovation, that's the absolute best.
So that does provide you with some authority, if you will, over the field in this hospital, but it also provides you with some accountability. You have accountability for the funds flow, not only just for the professional fee side of it, but also for many of the technical fees and hospital charges all come up through the Heart Institute for you and your other 2 co-directors, Dr. Barul and Dr. Munoz, to manage in close association with our nursing leadership there. So I think that is something that we across the country have tried to achieve, and we've worked hard to try to get that model here in Washington, D.C. So give us a glimpse of your vision for the next 5 years. What do you see in our future?
I keep repeating to people, I didn't come to Washington, D.C. to get a job. I had a very good job in Australia. I was working well. It's not a question of salary. I came here because I believe that I have the capacity to drive changes. And I want to test myself to see if I drive changes. Honestly speaking, if in 5 years' time, I find myself having a good job, and things are working well, and we among the best center in the country, I think I will have failed my objectives. I don't want to be, I mean, I want to be the best center, but that's not my objective. What I really want to, and what I came here for, is changing things. I want to influence practice. I want to make sure that we have a uniformization of practices in congenital heart surgery. I want to have new ideas, breaking the ceiling of the mortality in the first year of life of these babies. That's what I want to do. If in 5 years' time I look back and I'm just one of the best center in the country, that will not be enough.
Well, we certainly look forward to partnering with you to achieve those objectives. We at Children's National Hospital want very much to change the lives of children with congenital heart disease for the better. And we think that with the partnership that you've brought here to Washington, we'll be able to accomplish that. Thank you, Dr. Dudicum.
I look forward to it.